Imagine this. You walk into your doctor's office for a routine checkup, feeling perfectly fine. You think, I'm healthy, I exercise, I eat okay, nothing to worry about. Then your doctor mentions a single lab number on your blood test stand. That tiny number quietly predicts whether you could develop diabetes years from now. Sounds scary, right? But here's the thing, most people have no idea this number exists, yet it's one of the most powerful tools science has discovered for preventing diabetes before it starts. This isn't about random guesses, trendy diets, or complicated scans. This is about a simple, measurable marker in your blood that tells a story about your future health. And the best part, once you know it, there are actionable steps you can take to change the trajectory of your health. Even if you're in your 30s, 40s, or 50s. Here's the science. Researchers have tracked thousands of patients for over a decade. They discovered that one lab number sometimes overlooked in routine tests can predict type 2 diabetes years before symptoms even appear. It's subtle, silent, and sneaky. But once you know it, you can act early, avoiding insulin spikes, energy crashes, and the weight gain traps that often precede diabetes. Most people think diabetes is inevitable if you're genetically prone, but that's not true. Your lifestyle, diet, sleep, stress, and even small adjustments in daily habits interact with this lab number in a way that can either accelerate risk or prevent disease entirely. By the end of this video, you'll understand exactly what this lab number is, why it's so powerful at predicting diabetes, and how to naturally bring it into a healthy range without extreme diets or medications. The sooner you act, the greater your chances of staying free from diabetes for decades. So, what is this magic number that doctors often overlooked? It's called HbA1c, sometimes referred to as glycated hemoglobin. Don't worry if the name sounds complicated, it's actually quite simple. HbA1c measures the average blood sugar levels over the past 2 to 3 months, giving a snapshot of how much sugar your body has been dealing with over time. Unlike a single glucose test, which shows your blood sugar at that exact moment, HbA1c reveals the bigger picture, your long-term sugar exposure. Here's the critical part. Research shows that even an HbA1c reading in the normal range, something many doctors flag can indicate that your body is slowly losing its ability to manage blood sugar. This means your insulin is working harder, your cells are becoming more resistant, and the risk of diabetes is quietly creeping up. Studies reveal something shocking. People with HbA1c levels just slightly above normal are at a significantly higher risk of developing type 2 diabetes within the next 5 to 10 years. And here's the kicker, most of them feel perfectly healthy. There are often no symptoms at all, no fatigue, no constant thirst, no blurred vision. That's why this lab number is called a silent predictor. But there's good news. HbA1c isn't destiny, it's a warning signal. With the right lifestyle changes, you can bring it back to the optimal range and essentially rewind the clock on your diabetes risk. What can you do? Research consistently shows three powerful strategies: nutrition adjustments, lower refined carbs, avoid sugary drinks, and focus on fiber-rich vegetables, lean proteins, and healthy fats. Physical activity, even moderate movement like brisk walking, cycling, or resistance training, improves insulin sensitivity dramatically. Sleep and stress management. Chronic stress and poor sleep spike cortisol, which raises blood sugar. Mindful practices, proper sleep schedules, and stress reduction techniques help normalize HbA1c. Even small improvements in these areas can reduce HbA1c by 0.5 to 1 point in just a few months, which is enough to drastically lower your future diabetes risk. Understanding HbA1c is like having a health time machine. It gives you a chance to intervene before irreversible damage occurs, protecting your heart, kidneys, and overall energy levels for decades to come. Now that you know how important HbA1c is, let's talk about how to monitor it, what numbers to watch, and the lifestyle strategies that actually work. First, the numbers. A healthy HbA1c is usually below 5.7%, between 5.7% and 6.4%. You're considered pre-diabetic, which means your body is already struggling to manage blood sugar efficiently. Above 6.5%, doctors typically diagnose diabetes. But here is the crucial insight. Even a reading of 5.8% or 5.9% should trigger action, because your body is signaling that it's starting to lose control long before symptoms appear. The best part: you don't need medications immediately if you catch it early. Lifestyle adjustments alone can reverse prediabetes in most cases. Start with these key steps. Eat smart. Prioritize whole foods over processed ones. Vegetables, lean proteins, healthy fats, and low glycemic carbs stabilize blood sugar. Avoid sugary drinks, pastries, and refined grains that spike glucose. Move daily. Even 20 to 30 minutes of brisk walking can improve insulin sensitivity. Resistance training, like lifting weights or bodyweight exercises, also helps your muscles absorb glucose more efficiently. Sleep well. Chronic lack of sleep spikes cortisol, which increases blood sugar and drives insulin resistance. Aim for 7 to 8 hours of quality sleep per night. Manage stress, mindfulness, meditation, yoga, or even short breathing exercises can keep stress hormones and blood sugar under control. Track progress. Get your HbA1c checked every 3 to 6 months if you in the high normal or pre-diabetic range. Even small improvements can be motivating. The power of understanding your HbA1c is that it gives you a window of opportunity. You can prevent diabetes years before it would normally develop. Protecting your heart, kidneys, nerves, and eyes from long-term damage. Remember, diabetes doesn't appear overnight. It's a slow, silent process that can take years to manifest, but your lab results give you a head start to fight it proactively. Take these numbers seriously. They're your body's early warning system. And if you act now, you can rewrite your health story entirely. In the end, the story is simple but powerful. Your blood is trying to warn you long before diabetes ever shows up. That HbA1c number small, easy to check, and often overlooked is your early alarm system. It tells you whether your body is handling sugar properly and whether you're on a trajectory towards serious health complications. The best part? You're not powerless. By understanding this number and taking deliberate action, eating smarter, moving more, sleeping better, and managing stress, you can stop diabetes in its tracks. Sometimes even reversing pre-diabetes entirely. It's not about pills or quick fixes. It's about smart, consistent habits that give your body the advantage it needs. So, if your last blood work showed a slightly high HbA1c, don't panic, but don't ignore it. Treat it as an opportunity, a chance to prevent a disease that could change your life. The sooner you act, the better your chances of staying healthy for decades to come. Remember, knowledge is power. Your HbA1c is more than a number. It's a glimpse into your future health, and now you know exactly what to do with it. Take charge today, and your body will thank you tomorrow.